In this video, I'm going to talk to you about why you should never ignore a prolonged hoarse voice. So what do I mean by prolonged? Well, it's natural for us to have a hoarse voice sometimes after a bit of laryngitis, cold and flu. Maybe you've gone to a party and it's been really loud and you voiced really loudly, or you went to a festival. And it's common in those instances to get a little bit of hoarseness in the voice, a little bit of huskiness, but might just go on for half a day, a morning, maybe a day, maybe a bit longer. But if that goes on for more than a couple of days and then turns into a couple of weeks, then that's a bit of an issue and you really need to go and get that looked at. Now, in some cases, it'll be indicative of something that's not harmful, but nevertheless needs some treatment. And the way to get it looked at is to see an ear, nose and throat doctor. And you can get a referral for that via your GP, or obviously seek one out yourself if you're going privately. And they will look at your larynx and they'll look at the vocal cords and they'll just see whether they're just working fine and whether there's anything on the vocal cords. Sometimes a bit of inflammation. So if it's just laryngitis, they'll be a bit puffy and a bit inflamed, and they'll just get better over time. There's also something called acid reflux, and that can affect the voice, and that comes up and sometimes causes a bit of inflammation. And they usually give medicines to help with that. And then in other cases, people develop some swellings on the vocal cords, nodules, cysts, polyps. There's quite a few things you can get on your vocal cords that actually disturb the sound a little bit, make the voice a bit husky. So nodules, for example, are common in singers' voices because they use their voice a lot and sometimes the demands kind of strain the voice a little bit. In any event, all those things need an accurate diagnosis because it affects the kind of treatment you have. And sometimes things like cysts or polyps, they might just be treated surgically, maybe with a little bit of therapy. And sometimes things like nodules will be mostly treated just with therapy. However, if someone has a hoarse voice for 2 or 3 weeks and there's no real reason why they should have a hoarse voice, so they're not a big voice user or they haven't gone to a festival and sung all weekend, but they have a hoarse voice, then you really need to go and get that checked out, because without having your voice looked at, without having your vocal cords looked at, it's really difficult to determine what's causing that hoarse voice, because a husky voice or a hoarse voice can be, like I said, from nodules, a little bit of voice strain, or sometimes something more sinister. And something more sinister might be a little cancer on the vocal cords or somewhere in the larynx. And cancer of the vocal cords is something, when caught very early, that can be successfully remediated in many cases, in most cases. So it really needs to be looked at, diagnosed early, and then treated early. Once you make it to an ear, nose and throat doctor, and sometimes that's not easy by getting a referral, but once you're there, the doctor will look at you with some kind of scope. So it'll be a scope that goes through your nose, usually, it can be through the mouth, and it doesn't go down your throat, so don't worry about that. But it's just enough so that there's a camera at the end and they can look down and they can get you to make a few sounds and see how your vocal cords are moving. They get a nice image of the larynx. And there are some types of swelling, for example, that will need perhaps a little surgical help to remove them. And there are some that don't. They just need a kind of a rest period and maybe a bit of therapy. And some need an active course of treatment like nodules. But people can also have hoarse voices because their vocal cords might not be working so well. There might be one vocal cord that's actually lost a bit of its movement. And this can be quite common after certain types of viruses, actually, where there's a little bit of loss of function, a weakening of the vocal cord. And those types of issues really do need some help with a therapist. You can also get full-on paralyzed vocal cords for various reasons. I mean, sometimes with things like stroke, sometimes for other reasons, because other surgeries sometimes that you have to have sometimes kind of damage the cord or the nerve to the cords sometimes. And in those cases, there'll be some surgical options to help remediate that. And there'll also be some therapy. And very often these things are combined approaches. But you can see there are so many things that can cause a hoarse voice. And sometimes it's hard to know where they came from and why. And that's why, just to get sure you're on the right track of treatment, a prolonged hoarse voice always needs to be looked at. So any prolonged hoarseness, so 2 to 3 weeks of hoarseness, needs to get looked at by an ear, nose and throat doctor for a differential diagnosis to rule out anything sinister and just get you the right kind of treatment, the right kind of therapy, be that something with the ear, nose and throat doctor, or be that via voice therapy. So don't ignore a hoarse voice. If you found this video helpful, click the like button and subscribe to the channel.